This week, we are going to start with an introduction to public health nursing and also look at its evolution through history. It's important to understand the evolution of public health nursing to see where it fits in healthcare for patients and also for improving health outcomes in the community. Public health nursing is different than clinical nursing or bedside nursing, and it's very important for us to understand the differences and the similarities. Public health nursing is provided to individuals, families, communities, and entire populations, and we do this through a population based perspective or lens that enables the nurse to view their client within the context of the community in which they and their clients live. All aspects of the client's life are considered as public health nurses carry out the nursing process. Public health nurses practice in their communities where they can make a difference in the lives of their families, the people they serve, and their entire community on a daily basis. As you practice nursing in a variety of clinical settings, you can become aware that the health of the people in your families, neighborhoods, and communities actually affects everyone in the community, both socially and economically, because we're all interconnected. Public health nursing combines theory and practice of both nursing and public health. Public health nursing, like nursing practice everywhere, involves the interaction of the nurse and the client, the health of the client, the influence of the home, healthcare, community, and environment, and the nursing care provided. But one of the unique features of public health nursing is that the client can actually be an individual, a family, a group of people, or an entire community. Public health nursing is considered population based because it starts by focusing on the population as a whole in order to determine the community's priority health needs. To be population-based, public health nursing practice should meet 5 criteria. It needs to focus on entire populations possessing similar health concerns or characteristics. This could be a group of individuals that are diabetic or people that live within the same zip code. It has to be guided by an assessment of the population health status that is determined through a community health assessment process. It has to consider the broad determinants of health. We will learn more about the social determinants of health later on, but when we talk about determinants of health, we're not just talking about comorbidities here. We're talking about somebody's income, their education, access to transportation, access to healthcare. So there's a lot of determinants that actually ends up impacting somebody's health outcomes. One of the criteria is also to consider all levels of prevention with a preference for primary prevention, and to consider all levels of practice, the individual, the family, the community, and the system. Public health nurses can be found anywhere. Like I stated before, public health nurses can actually be found anywhere. You may find them doing home visits. This is associated with new moms or WIC, Women and Infant and Children, a program that comes down from the federal level and then is carried out by states and local health departments. You could find them in clinics, such as sexually transmitted infection clinics. You might find them in jails and prisons because this is an entire population that the nurse is looking after. You can find them in homeless shelters. You can find them in camps. There are some hospitals that have population-based programs. A lot of times when hospitals have this, they're looking at specific subgroups within their catchment, their area of patients that might have similar comorbidities, such as individuals with diabetes or individuals with cardiovascular disease. What public health nurses do here is they don't just consult with one patient, they look across the entire patient and all the health records to determine what kind of education might be most beneficial in the interactions between bedside nurses and individual patients. A lot of A lot of public health nurses you'll find at the federal level, at the state level, and even at local health departments. You may also find some public health nurses that work with nonprofit organizations. It is important to go over some of the milestones within the evolution of public health nursing, as well as a few key people that were pivotal in getting public health nursing recognized as a discipline. Nurses have actually always been very essential participants in improving and maintaining the health of individuals, families, and communities. Florence Nightingale started her nursing career in 1850 and provided leadership for the health of vulnerable populations by advocating for changes in the organizations and communities that were responsible for providing health care. Nightingale focused on managing the environment of those who needed care, whether it was on the battlefield or working with the poor. Her concerns about the impact that environmental conditions can actually play on health and her work for advocating for better environments is as relevant today as it was in the 1800s. Lillian Wald, the founder of the modern day public health nursing, founded the Henry Street Settlement in 1893 to provide nursing services to the indigent citizens of New York. In 1903, she also collaborated with Metropolitan Life, starting the first insurance reimbursement for nurse home visiting and demonstrating its effectiveness. The Henry Street Settlement House continues to provide health and social services today. Public health nursing in the United States developed out of a need to provide nursing services to individuals and families who had unmet health needs, and started with Clara Barton, who founded the American Red Cross as a response to the needs of injured and ill Civil War soldiers in 1881. Public health nurses saw themselves not only as caregivers, but as advocates for those that were living in unhealthy conditions and might be experiencing unmet healthcare needs. Care of the ill soon expanded to care of those at risk for poor health and to populations in entire communities. Disease prevention and health promotion for vulnerable or at-risk populations in diverse settings became a huge focus at this time. In the 1940s, public health nursing became part of the American Public Health Association that was founded in 1872. Until the late 1960s, public health nurses working for governmental public health agencies generally provided services to two at-risk populations: mothers and children, and adults living at home with chronic diseases and disabilities. When Medicare legislation was enacted in 1966, home care became a covered service and private agencies began to offer home care services. Many public health agencies renewed their commitment to the goals of health promotion, disease prevention, and protection, and risk reduction, and they stopped providing home care to adults with chronic diseases and disabilities. Public health nurses increased their efforts to address social determinants of health, which are discussed later in this course. Today, public health nurses often work with community groups as well as individuals and families. Community engagement, population-based advocacy, collaboration with other community agencies and groups, and community organizing are all part of the scope of public health nurses. These are the references that were used for this PowerPoint. They are great resources if you would like additional resources for any of your assignments this week.